से काम कर रहा हूं, ऐसे शुभेंदु अधिकारी जी, हमारे डॉक्टर शरद वत्स मुखोपाध्याय जी, डॉक्टर मधु चंद्रकार जी, हमारे बहुत ही गणमान्य और बहुत ही आदरणीय रिस्पेक्टेड डॉक्टर्स और हमारे मीडिया के मित्र और पार्टी के हमारे वरिष्ठ कार्यकर्ता बंधु नेतागण, ये मेरा सौभाग्य है. दिस इज indeed a matter of great opportunity to be with you this evening to discuss the issues related to health and the initiatives taken by the Prime Minister Narendra Modi ji's dynamic leadership, the interventions in the health sector which has taken place. First of all, सबसे पहले तो मैं पश्चिम बंगाल की धार्मिक, सांस्कृतिक, राजनीतिक जागृत भूमि को नमन करता हूं और आशीर्वाद लेकर के अपनी बात को प्रारंभ करता हूं. हमेशा से हम सुनते आए हैं, जो सच्चाई है, what Bengal thinks today, the country understands and works accordingly tomorrow. So, this is the leadership which Bengal has given. And when I am here, first of all, I would like to pay my respects to Dr. Kadambini Ganguly ji for her dedication and for the women empowerment she gave as the first lady medical practitioner to West Bengal. I really pay my respects to them. When we talk about the medical profession, I would also like to share with you that it is an opportunity for me, because you are the leaders of the society. The issues which will be raised today by me will amplify through you to the society, because you are the leaders. Any information, any intervention by you makes an impact in the society. So it's really an opportunity for me to have an interaction with you in this doctor's meet. When we talk about the Viksit Bharat, developed India, the foundation is that we should have a healthy India. If we have a healthy India, that will be form the foundation and the base of Viksit Bharat, of developed nation. So health is a very important factor which we have to understand and which we have to see to it that how do we go to address the issues related to health. In the past 11 years, historic interventions and historic initiatives have been taken as far as health sector is concerned. For long, if I talk about the health policy of 1997-98, if I talk about the health policy before that also, we may realize the whole concentration of the health sector was on the curative side. पहले बीमार पड़ो, फिर इलाज करो. So the emphasis was on the curative part. But in 2017, when we initiated a new health policy with having a very detailed discussion throughout the length and the breadth of the country, right from north to south, from east to west, had regional conferences, interactions took place, more than 500,000 suggestions came, many seminars took place, many conferences took place, and then we came out with a health policy which is known as the health policy of 2017. Now this health policy was different from the previous health policy. And what was the difference? That emphasis was not only on the curative part, But curative part was one of the parts, but the health policy was inclusive, comprehensive, and it included every aspect of the health. So preventive health, promotive health, curative health, palliative health, rehabilitative health, geriatric health, all this was taken into one approach that was called as a comprehensive health policy. And in this comprehensive health policy, we also decided that it will have a whole of the government approach. The departments will not work in silos. We are now talking about, under the dynamic leadership of Prime Minister Modi, we are talking about one health approach. When we say one health approach, environment is a factor. Animals are a factor. Their feeding is also a factor. Agriculture is also a factor. So when we say a whole of the government approach, that means all sectors have to come to on one platform to see that the human being and the cattle and the plants all are healthy if we want the human being to be healthy. So this holistic approach was adopted and it was brought forward. Now for this, what did we do? We established 1,81,000 Ayushman Arogya Mandir. Nearly, we plan to have a facility which will cater minimum to 3,000 to 4,000 population. So at this point of time, we have got 1,81,000 Ayushman Arogya Mandir serving the 1.4 billion people of the country. Now this is the first contact point. You see, 1.4 billion people, how will you cater? It's not only the tertiary healthcare which is going to take care. It's not only the secondary healthcare. We have to see to it that the tertiary healthcare should be there up to the mark. We have to strengthen the secondary healthcare. But we have to see to it that the primary healthcare and primary contact is very, very strong and robust, that we have to see. So for the past 6-7 years, we are concentrating on the primary healthcare, that is the Ayushman Arogya Mandir, which is the first contact point. And for that, we have trained the ASHA workers, we have trained the community health officers, and we have tried to see to it, encourage the ASHA workers, that every individual, by taking the help of ASHA workers, the community health officers, the panchayat pradhans, the BDC members, we are trying to see to it that every person at the age of 30 should visit the Ayushman Arogya Mandir facility. And we are going for a screening. And screening is for cancer, males for oral cancer, females for cervix cancer, females for breast cancer. And you will be happy to note that by this time, more than 40 crore people have been screened for oral cancer, and more than 20 crore women have been screened for breast cancer and for cervix cancer. But this is just the start. And for the Ayushman Arogya Mandir, what we have done is that we have developed NQAS, National Quality Assessment Standards. Now in this NQAS, we are trying to see to it that the facility should have a particular level of quality. So for that we have developed a call which is called as NQAS. And I am happy to share with you that out of 1,81,000, we have achieved NQAS level in 50,000 facilities we have achieved. We are giving them 12 types of packages. First of all, mother and the child reproductive system, mother reproductive system and the child health care. Then eyes and ENT, dental care, mental care, elderly palliative care, and we are providing them with free drugs and diagnostic facilities. In the reproductive child health care, we have developed a portal which is known as UWIN. Now this UWIN takes note of all the pregnant mothers, their deliveries, and after the delivery, from birth till 16 years, we give them for 12 preventable diseases, 11 vaccines in 27 sessions, which starts from the first year, from the birth till the age of 16, and everything is captured in this UWIN portal that we have to understand. Now this is changing India, which we call as digital India. This is digital India. At any given time, we have got a cohort of 5 crore, mother and the child. 2.5 crores are women, mothers, the pregnant or the lactating mothers or delivered mothers, and 2.5 crores are the children who are born. So 5 crore cohort को हम हमेशा लेकर के इस UWIN portal में चलते हैं, and this is how we are digitally tracking, and we are trying to see to it that every child gets 27 sessions of vaccines, and which is captured in this UWIN portal. Now how do we do it? It has got an alert system. For example, if the child is to be given a vaccination after 3 months of his birth, if the mother does not go to the facility, there's an alert to the ASHA worker, there's an alert to the message to the mother, there is an alert also to the BMO, block medical officer, and there is also alert at the headquarters of UWIN, where we track and we see to it that every child takes all those 27 sessions. So this is how we are trying to see to it that how do we see India a healthy child, healthy mother. And the results it has given. In 2014, according to the National Family Health Survey, NFHS, National Family Health Survey, the institutional delivery was 79%. And in 2019-21, the institutional delivery has increased to 89%. And I'm talking about 2021. I'm not talking about 25-26. Certainly, by 25-26, it might have increased to more than 92, 93, 94%. So this is how we are taking the initiative forward, which I would like to share with you. I'd also like to share with you about the maternal mortality ratio. And these are not my figures. These are figures of National Family Health Service, and which is vetted by WHO. In 2014, according to the sample registration system, in 2014-16, the MMR, maternal mortality ratio, was 130 per lakh live births. And in 2021, again, it's not 25-26. I'm talking about the samples registration system. In 2021, it is 88 per lakh live births. That means the decline is 42 points of mortality that we have to understand. The decline in the infant mortality rate is 39 per thousand live births was in 2014, which has declined to 27 by per thousand live births in 2021. According to the UN report, the percent of decline in 2015 to 2023, the under 5 mortality, the decline in India under 5 mortality is 42%, and the global decline is 14%. So you can understand how India is going faster than the world. The global decline is 14% and the Indian decline is 42%. That we have to understand. And this is the UN report which I am quoting. The neonatal mortality, the decline in India is 39%. And the global decline is only 11%. Now you can understand how these initiatives of the Ayushman Arogya Mandir, how these are, मैं दावे के साथ बोल सकता हूं, because you see, one bad news in a hospital becomes a news nationwide. But the good work which you all do day in and day out and save thousands and lakhs of lives, that is not a news. But I would like to share with you that if I talk about the neonatal mortality, it is 39%, which is global decline is 11%. And all these initiatives, मैं दावे के साथ इस बात को बोलना चाहता हूं कि the day the mother conceives, from that very day, 5 antenatal checkups are done and 1 checkup is done by the specialist. And for high risk patients, the antenatal checkup is 8 times, 3 times by the specialists and 5 times by the ordinary doctors. This we do, and after that the vaccination program starts and the institutional delivery starts. All this accumulative effect is what I am talking about, the MMR, what I am talking about the IMR, what I am talking about the under 5 mortality. It is all because of this that India is giving good results. You all know that WHO has certified that we are now polio free. We are now neonatal tetanus free. Trachoma is now no more a public concern. And we have only sustained for 1 more year. India will be Kala-Azar free. That we have to understand. And this is how we are working. You see, if I talk about malaria, you know how much West Bengal was also facing the problem of malaria. But when I talk about malaria, we have the 1/6 of the population. But only 0.7% of the global cases of malaria are reported in India now. Only 0.6% of global malaria deaths are in India. Since 2015, the decline in the incidence of malaria is 80% decline in the past 10 years. And the decline in deaths is 78%. Now you see how we have addressed the issue of malaria. That also I would like to share with you. Now the recent report which has come from the WHO organization in 2025, it says that the decrease of incidence in tuberculosis was 237 per lakh population, which is now 187 per lakh population. The decline is in India 21%. And the decline global is only 12%. This is the UN report that we have to understand. The World Health Organization report of 2025. The reported cases of tuberculosis has increased, but the incidence has decreased, and the treatment is also up to the mark. The treatment coverage in 2014-15 was 53% in India, and now the treatment in India in 2024, the treatment percentage is 92% people are being treated for tuberculosis. That we have to understand. And the global treatment is only 78%. You will be happy to note that last year we had a special drive of 100 days only to detect the tuberculosis patient, and we detected 26 lakh TB patients diagnosed in 2024, highest in single year. And this was done because we have developed the AI-enabled X-ray handheld machine. So now everybody may not go for, पहले tuberculosis में क्या होता था कि जब तक तो खांसता रहे, खांसी जाए नहीं, जब तक बुखार उतरे नहीं, जब तक वो डॉक्टर और इंस्टीट्यूशन पहुंचे नहीं, तब तक उसका इलाज शुरू ही नहीं होता था. Now what we are doing here, we are doing a handheld X-ray machine through AI enabled. So it comes out the chest has got some abnormality. If the AI generates that abnormality, the patient goes for a sputum check. And through this we are able to detect the tuberculosis patients. And you will be happy to note that because of this, the treatment success now in India is 90% and the global treatment is 88%. That we have to understand. A very paradigm shift has taken place with the initiative by Prime Minister Narendra Modi ji, and that is PM Jai, Pradhan Mantri Jan Arogya Yojana. That is the Ayushman Bharat. Luckily, health has been a sector which I have been representing since 1998. I got the opportunity to lead the health department in my home state, Himachal Pradesh. Then I got the opportunity as a union minister in 2014. And then again I got the opportunity for the third time in 2024 to head the health department. When in 2014 India got the opportunity to chair the World Health Assembly, I was the health minister. And in Geneva I had to chair the World Health Assembly. At that point of time, the world was discussing about universal health coverage. And when they were discussing about universal health coverage, I was thinking that I am chairing this World Health Assembly. Whether India will be able to have this universal health coverage, whether we will be able to do something about it or not. When I came back to my native land, I started bringing some policies and programs for universal health coverage. And I went with those programs to my leader, Prime Minister Modi ji. When I discussed with him, he said to me, why are you thinking in tidbits? आप ये छोटे छोटे इनिशिएटिव्स की क्यों बात करते हो? अगर यूनिवर्सल हेल्थ कवरेज लाना है तो कुछ बड़ा सोचो, think big. And then he came out with the Ayushman Bharat, which is the world's largest health coverage program which India has given. It's the world's largest health coverage program. 63 crore people, nearly 40% of the Indian population. And who are they? The marginal section of the society. Not by caste, but by profession. Redi wala, thele wala, rickshaw wala, sabji wala, auto rickshaw driver, bus ka driver, bus ka cleaner, truck ka driver, truck ka cleaner, lift man, hotel में काम करने वाला, हमारा वेटर, हमारा बर्तन साफ करने वाला, ऐसे गरीब लोगों को जो कभी सोच भी नहीं सकते थे, उनको प्राइम मिनिस्टर मोदी ने 5 लाख रुपए का हेल्थ कवरेज एवरी ईयर टू एवरी फैमिली दैट वाज गिवन. When I talk about the Ayushman Bharat and 63 crore people, that means that the population amounts to the whole of Europe. उतना तो हमारा आयुष्मान भारत है. And this is how, and 33,000 hospitals have been impaneled, 10 crore hospital admissions have been done, and 1.4 lakh patients have been authorized with Ayushman Bharat. So 1.4 lakh crore has been spent on the poor families for their treatment and for their life-saving. But I'm sorry to say, I do not want to play politics here, but I'm sorry to say that West Bengal, the people of West Bengal are deprived of this facility. They are deprived. I was the health minister last time. I came out with the Ayushman cards. But I came to know that those Ayushman cards were torn and thrown into the drain. It was not allowed. I told Mamta ji, what is their fault? They are poor people. This is a portable mechanism. Any West Bengal worker, if he is working in a place in Himachal Pradesh और वहां कोई सोने की दुकान में काम करता है और उसका आयुष्मान कार्ड है, तो उसका मैं हिमाचल प्रदेश में इलाज करा दूंगा और वेस्ट बंगाल से उसका पैसा सीधे उसको जाकर के उसकी इंस्टीट्यूशन को मिलेगा. दिस पोर्टेबिलिटी इट हैज. लेकिन ममता दी को क्या समझाएं, कौन समझाए? होबे ना, করবে না. हमने कहा होबे ना, कोरबे ना, क्या आपको, why, what is the problem? Now this, in 2024, Modi ji added anybody above the age of 70, of any economic criteria, of any religion, of all genders, will be included after 70 years, till he or she breathes her last. He or she will be getting 5 lakh rupees annual health coverage. That is what Prime Minister Modi has given. But the people of West Bengal are deprived of it. और आपको तो मालूम है कि इंश्योरेंस कंपनी भी 60 साल के बाद इंश्योरेंस करना हेल्थ का बंद कर देती है, और हम तो 70 से शुरू करते हैं और अंतिम समय तक, अंतिम सांस तक उसको हम हेल्थ कवरेज देते हैं. ये हमारा हेल्थ कवरेज का प्रोग्राम है. लेकिन one ray of hope I see, that there were 3 states who had disallowed Ayushman Bharat. One was Orissa. Naveen Babu said, Hobena. In Orissa, people rejected and lotus blossomed there, and now they have an Ayushman Bharat. The another state was Delhi. केजरीवाल, नहीं चाहिए, नहीं चाहिए, नहीं चाहिए. दिल्ली ने कह दिया तुम ही नहीं चाहिए, उसको राइट ऑफ कर दिया, और वहां भी कमल खिला और आयुष्मान भारत पहुंचा. और इट्स नॉट ए रे ऑफ होप. आई हैव फुल कॉन्फिडेंस दैट वेस्ट बंगाल में भी होबेना को होबे होबे होबे. और यहां भी कमल खिलेगा और आयुष्मान भारत आएगा. इस बात का मैं आपको विश्वास दिलाना चाहता हूं. ये आपसे मैं जरूर कहूंगा. Now see what the Ayushman Bharat has brought the difference. Lancet says that from the detection of cancer in India, 90% people get facilities within 30 days. After the diagnosis, the treatment starts within 30 days. And this is because of Ayushman Bharat that we have to understand. Because it was the poor people. Poor people क्या बोलते थे? बेटा मेरी जिंदगी तो गई, अब तुम बच्चों की जिंदगी क्यों ले रहे हो? उनको तो पढ़ने दो. तुम मेरा इलाज कराओगे, घर बिक जाएगा, मकान बिक जाएगा, हमारी जिंदगी का कोई रास्ता नहीं है. लेकिन आज उनके पास गौरव से आयुष्मान कार्ड है, जिसके तहत उसका इलाज हो रहा है, और हम 90% पीपल को हम विद इन 30 डेज हम ये फैसिलिटी दे रहे हैं. अगर मैं बात करूं वेस्ट बंगाल में, तो मेरे को एक चिंता होती है कि एमएमआर वेस्ट बंगाल में मैटरनल मोर्टेलिटी रेशियो इज मच हायर 104 देन द नेशनल एवरेज, and it had declined only 11% since 2010-11. The national decline is 35%. Now this speaks volume. अगर मदर की mortality rate रेशियो अगर डिक्लाइन नहीं हो रहा है, तो इसका मतलब हमारे यहां फैमिली वेलफेयर की दृष्टि से जिन प्रोग्राम्स को नीचे तक जाना चाहिए वो जाने में असमर्थ रही है. दैट वी हैव टू अंडरस्टैंड. अगर मैं मेडिकल एजुकेशन की बात करूं, टर्शरी हेल्थ केयर की बात करूं, यू सी वी हैड ओनली वन ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज सिंस द एंड ऑफ द 20th century के एंड तक वी हैड ओनली वन ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज. It was in 2003 that Atal Bihari Vajpayee opened 6 new All India Institute of Medical Sciences. And you will be happy to note in the past 11 years, 18 more institutions have come. Now there are 23 All India Institute of Medical Sciences, which includes West Bengal, Kolkata also, Kalyani also, that we have to understand. If I talk about increase in medical seats, हम लोग ब्रेन ड्रेन की बात करते थे. इन 2014-15 sorry, we had only 387 medical colleges. Now we have got 819 medical colleges. We had only 51,000 undergraduate seats. Now we have got 1,29,000 medical seats. We had only 31,000 PG seats. Now we have got 80,000 medical PG seats. And Prime Minister Modi ji ne 2024 mein ramparts from Lal Killa, he said that we will have in next 5 years 75,000 medical seats added. And we are on the track. In the past 1.5 years, 23,000 medical seats have been added. That I would like to share with you. तो हम गवर्नमेंट के सेक्टर के साथ, प्राइवेट सेक्टर के साथ मिलकर के मेडिकल सीट्स को बढ़ाने के लिए और मेडिकल एनहांसमेंट के लिए हम काम कर रहे हैं। एग्जिस्टिंग मेडिकल कॉलेजेस में हम सुपर स्पेशलिटी ब्लॉक्स दे रहे हैं। 75 मेडिकल कॉलेजेस हैव बीन गिवन द सुपर स्पेशलिटी ब्लॉक्स। हम एग्जिस्टिंग डिस्ट्रिक्ट हॉस्पिटल्स को मेडिकल कॉलेजेस बना रहे हैं ताकि हम ज्यादा से ज्यादा पीजी सीट्स और यूजी सीट्स दे सके। अब ये सब रिफॉर्म्स, इन सारे रिफॉर्म्स को एक तरीके से रोक रखा था। इन सारे साइलोज को हम तोड़ने का प्रयास कर रहे हैं और सबके साथ मिलकर के हम इस काम को आगे बढ़ाने का प्रयास कर रहे हैं। मैं आपके सामने एक पब्लिक हेल्थ चैलेंज को कैसे मीट आउट किया है प्राइम मिनिस्टर मोदी जी ने, उसके बारे में भी शेयर करना चाहूंगा। यू सी, वी हैड ए पेंडेमिक कॉल्ड कोरोना, और कोरोना में आप सबको मालूम है कि वर्ल्ड डिड नॉट नो, द डेवलप्ड नेशंस आल्सो डिड नॉट नो हाउ टू एड्रेस दिस इश्यू। कोई नहीं जानता था, किसी को भी नहीं मालूम था कि इसको हम डील कैसे करेंगे। आपको मालूम है कि अमेरिका में लॉकडाउन लगा तो स्ट्राइक्स हो गई, यूरोप में लॉकडाउन लगा तो स्ट्राइक्स हो गई। वैक्सीनेशन की बारी आई तो वैक्सीनेशन को लोगों ने रिजेक्ट कर दिया, स्ट्राइक्स हुई। एंटी वैक्सीनेशन प्रोग्राम को लोगों ने पब्लिक मूवमेंट बनाने का प्रयास किया। लॉकडाउन के बारे में दे वर नॉट श्योर, बट व्हेन इन इंडिया जब कोरोना का केस आया, कोरोना की महामारी आई, तो प्रधानमंत्री जी ने कोरोना की लड़ाई सरकार ने नहीं लड़ी, सरकार ने भारत की जनता के साथ मिलकर के लड़ाई लड़ी। दैट वी हैव टू अंडरस्टैंड। पहले जनता कर्फ्यू, बाद में फिर लॉकडाउन। और लॉकडाउन क्यों लगाया गया? इसलिए कि एट दैट टाइम, पॉइंट ऑफ टाइम, वी डिड नॉट हैव मास्क्स, we did not have ICU beds, we did not have ventilators, we did not have the oxygen machines, we did not have the oxygen plants. All within the period of 1 month, the nation was prepared for it. We had sufficient ICU beds, we had sufficient masks, we had sanitized the people. और ये सारी चीजों के साथ जब देश तैयार हो गया तो हमने लॉकडाउन हटाया, प्राइम मिनिस्टर मोदी ने लॉकडाउन हटाया और देश आगे चल पड़ा। और आई मस्ट सैल्यूट द मेडिकल प्रोफेशनल्स जिन्होंने अपने जान की चिंता नहीं की, लेकिन कोरोना को हेड ऑन लिया और इस लड़ाई को लड़ने में उन्होंने अपने आप को जोड़ा। इसके लिए मैं आपको बधाई देना चाहता हूं। मैं एक बात और बताना चाहता हूं, क्योंकि ये बातें आप लोग इतना महान कार्य कर जाते हो लेकिन आप लोग ध्यान नहीं रख पाते, इसलिए आप लोग को याद दिलाना चाहता हूं। यू सी, इस देश में ट्यूबरकुलोसिस की दवा को आने में 25 से 28 साल लग गए। इस देश में टेटनस की दवा को आने में लगभग 27 साल लग गए। इस देश में अन्य बीमारियों के लिए, जापानीज इंसेफ्लाइटिस के लिए दवा को आने में 100 साल लग गए। 1906 में आ गया जापान में, 2006 में भारत में आया, और नेशनल प्रोग्राम बनते बनते तो और टाइम लगा। यानी हम लोगों ने तय कर लिया था कि वैक्सीन बनेगी तो विदेश में, हम तो इंतजार करेंगे और हम तब तक के लिए इंतजार करेंगे जब तक हमें मिल ना जाए। आपको जानकर खुशी होगी कि फर्स्ट केस ऑफ कोरोना केम इन जनवरी 2020, जनवरी, एंड इट वाज इन अप्रैल दैट प्राइम मिनिस्टर मोदी ने टास्क फोर्स बैठाया और उस समय 2-3 कंपनियों को, 2 कंपनीज को इस काम को दिया गया। फुल फाइनेंशियल सपोर्ट वॉज गिवन, फुल बैकिंग वॉज गिवन, फुल मॉरल सपोर्ट वॉज ऑल्सो गिवन, एंड इंडिया ने 9 महीने के अंदर एक नहीं 2 वैक्सीन बनाई। दैट इज इंडिया, दैट इज द चेंजिंग इंडिया वी हैव टू अंडरस्टैंड। और दूसरी बात कि सभी जगह पर वैक्सीनेशन कहीं 60% से 67% डेवलप्ड नेशंस में लोगों ने वैक्सीन नहीं ली, लेकिन यह भारत ही था जिसने डबल डोज विद बूस्टर 220 करोड़ सेशन करके अपने आप को कोरोना से मुक्त कर दिया। यह भी हमको अंडरस्टैंड करना चाहिए। और सबसे बड़ी बात कि दिस इज डिजिटल इंडिया। अमेरिका में कोविड का वैक्सीनेशन का सर्टिफिकेट कागज में मिलता है, भारत में कोविड का वैक्सीनेशन सर्टिफिकेट आपके मोबाइल पर मिलता है कोविन के कारण। दैट वी हैव टू अंडरस्टैंड। दिस इज चेंजिंग इंडिया, दैट वी हैव टू अंडरस्टैंड। और 2020 करोड़ डबल डोज विद बूस्टर, तो ये बदलते भारत की तस्वीर है जो आपके सामने मैं रख रहा हूं। हेल्थ के सेक्टर में हमने कोशिश की है, सबको, सारे फोर्सेस को हम एक साथ ला रहे हैं। आयुष के बारे में भी मैं कहना चाहूंगा, हमने हर एक ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज में सेंटर फॉर इंटीग्रेटेड मेडिसिन खड़ा किया है, आयुष ब्लॉक खड़ा किया है। और सेंटर फॉर इंटीग्रेटेड मेडिसिन को हमने क्या कहा है? सेंटर फॉर इंटीग्रेटेड मेडिसिन को हमने कहा है एविडेंस बेस्ड हमारे को डेलिब्रेशन करना होगा। और हमने आयुष के साथ बहुत से कोलैबोरेशंस किए हैं। आज वर्ल्ड का ट्रेडिशनल मेडिसिन का हेडक्वार्टर्स भी जामनगर है। दैट वी हैव टू अंडरस्टैंड एंड वी आर वर्किंग विथ वेरी क्लोज क्वार्टर्स। आयुर्वेद में क्या था? इट्स ए ट्रेडिशनल मेडिसिन। आयुर्वेद में क्या था कि फैमिलीज की मेडिसिन के साथ चलती थी एंड द ट्रेडिशनल नॉलेज वाज ट्रांसफर्ड फ्रॉम वन फैमिली टू अनदर टू द नेक्स्ट जनरेशन, लेकिन उसका शेयरिंग नहीं होती थी। नाउ व्हाट वी हैव डन दैट वी विल हैव एविडेंस बेस्ड रिसर्च एंड एविडेंस बेस्ड रिसर्च के साथ साथ वी विल बी वर्किंग नॉट इन साइलोज बट इन इंटीग्रेटेड वे। As allopathy is important, the same way Ayurveda, yoga has got its own. Now in All India Institute of Medical Sciences, we are doing research how yoga brings difference to the heart. What is the effect in cardiology? What is the effect on the brain? वो कितना stimulate करता है brain को, कितना activate करता है. All this evidence is being captured, and on evidence based we are going for an integrated medicine. So now this is changing India, बदलता भारत है with new initiatives। मैंने आपके सामने अब हेल्थ, आप सब लोग जानते ही हैं, आप सब लोग MBBS करते हो, MD करते हो, DM करते हो, और पता MCH करते हो, और पता नहीं कौन कौन सी आप सब डिग्रीज लेते हो। उसके बावजूद भी आपसे पूछे तो आप बोलते हो वी नो 1/100th ऑफ द ह्यूमन बॉडी, विच इज करेक्ट कि आप ही बोलते हो कि वी नो 1/100th ऑफ द ह्यूमन बॉडी। इसके बावजूद भी हेल्थ बीइंग सच ए वास्ट सब्जेक्ट, उसको आप कहोगे कि 40 मिनट के अंदर रख दो, तो वो किसी भी हेल्थ मिनिस्टर के लिए संभव नहीं होगा। लेकिन मैंने कोशिश की है कि आपके सामने आई वुड लाइक टू पुट दिस सिनेरियो हाउ प्रोएक्टिवली एंड हाउ हेड्स ऑन प्राइम मिनिस्टर मोदी जी इस इनिशिएटिव्स को लेकर के चल रहे हैं और हेल्थ को एक पब्लिक प्राइवेट पार्टनरशिप के तहत हम आगे बढ़ाने का प्रयास कर रहे हैं। इस स्कीम के तहत हमने कोशिश की है कि हम हेल्थ फॉर ऑल एंड गुड हेल्थ फॉर ऑल, प्रिवेंटिव, प्रोमोटिव, क्यूरेटिव, पैलिएटिव, रिहैबिलिटेटिव, सब पर हम बराबर का जोर दें और इस काम को आगे बढ़ाएं। इसी बात को लेकर के हम चले हैं। आप सब लोगों ने आज मेरी बात को बहुत शांति से सुना है, इसके लिए आप सबका बहुत बहुत धन्यवाद। जय भारत, जय बंगाल।